The number of new COVID-19 cases in China is continuing to fall, but according to the experts, it's too early to say if the outbreak has been contained.
Another 98 people have died on the mainland, taking the death toll to 1,868. More than 72,000 people have been infected and are being treated in hospital.
A hospital director at the epicenter of the outbreak in Wuhan is one of those who's died. Liu Jiming worked at the Wuhan Wuchang Hospital. More than 1,700 medical workers have contracted the virus and 6 have died.
Doctors and nurses on the front line have been risking their lives due to a shortage of protective masks and suits. Some medics have begun using industrial protective suits, which are heavier and more airtight.
The lockdown of cities and restrictions on travel in China have helped limit the spread of the virus. But this is now taking a huge toll on the country's economy. Factories remain closed while trade fairs and industry conferences have been postponed or cancelled.
The tourism sector seems to be taking the biggest hit. Tens of thousands of flights have been cancelled because of the outbreak. And despite this, President Xi Jinping says China will still be able to meet its 2020 economic target.
Our correspondent Lynette Lim has been following developments in China. She joins us now in studio. Lynette, good to see you as always. Now, the coronavirus has severely disrupted businesses in China. We've seen Singapore's budget try to address things here. What has China been doing to mitigate the impact?
Well, the government has announced several measures, including, securing raw materials for businesses, easing some of the roadblocks in less affected areas so that, logistics supply can proceed smoothly, providing gas, electricity and oil to companies and even helping companies obtain loans. So they're trying to do their best to mitigate some of the disruptive impacts. However, we also know that of about 300 million migrant workers who left the cities for their hometowns, only a quarter of them have returned, partly, due to disruptions in traffic, transport, partly also due to fears, so many are still staying put, being under home quarantine voluntarily, and that's going to be a huge problem for any factories when it comes to a resumption of work. Globally, because China is such a big supplier and manufacturer, we've already seen companies like Apple issue advisories saying that, iPhone supply is going to be hit, sales are going to be hit, and pharmaceuticals as well, because China provides a lot of the active ingredients in vitamins and antibiotics. That's also going to possibly cause global drug prices to go up.
Lynette, so every day we're learning something new about the coronavirus, COVID-19. And since the outbreak began, we know that the incubation period of the virus has continued to lengthen. Tell us more about what's happening.
So, current wisdom is that 14 days. So that's also the prescribed quarantine period for many jurisdictions, including Singapore. But we did learn of a recent report in Henan province, which neighbors Hubei, where 2 cases of extremely long incubation periods, where one of the patients, he tested positive after 34 days after coming back from Wuhan. Another patient tested positive 94 days after coming into contact with someone who had been to Wuhan. So this caused Henan province to actually increase the quarantine period from 14 days to 21 days. However, we also know that majority of the cases fall within the 14 days. So I think people are still trying to make sense of the outliers. And we also know that in recent days, the fatality rate has started to show a slight uptick. We don't know enough to make any conclusions, but we can possibly explain it by the fact that in the early phases, there were not enough testing capacity. So now that there's more testing capacity, more deaths can be confirmed as COVID-19 deaths.
All right, thanks for that. Lynette Lim speaking to us in studio here.